In the previous session, we explored how consumer voice is embedded at a governance level, and this session takes that a step further into how that is experienced and applied in practice. So we'll be hearing from a panel working across different parts of the system, from those directly responding to the feedback through to those shaping how consumer voice is used at the system level. So joining us on this panel, we have Delaney Gibbons, Director, Safety, Quality and Performance, NMHS. Delaney, please make your way up. We have Emma Ball, Safety and Quality Lead at SMHS. We have Tanya Harris, Engagement Manager, Health Consumers Council, WA. Thanks, Tanya. And Karina Moore, Acting Director, Health Networks, Clinical Excellence Department of Health, WA. Please make welcome our panellists. Thank you for joining us this morning and welcome. Okay, again, I've got a few questions that I will commence by asking our panellists, but in the meantime, please feel free to think about any questions that you may have, so there will be an opportunity for you to ask them. Okay, the first question is for Karina. From a systems perspective, how does narrative feedback, including through platforms like Care Opinion, fit within the broader approach to consumer feedback and engagement across WA Health?
Thank you for that question on notice, because it gave me an opportunity to reflect on my experience of receiving consumer and carer feedback. I was actually born in the dark ages, so my experience in this space spans a couple of centuries. And when I think about my first experience of receiving feedback, I worked in the complaints unit at Royal Perth Hospital for 3 months. And we thought we were amazing and innovative because when people wrote to us and raised a concern or a complaint, the first thing we thought was amazing was that we responded to them within 7 days to say we'd received their complaint. And then the other amazing thing we did was get all the people in the room, the clinical people, the person raising the concern, to have a conversation about what happened and come to an agreement on the best way forward, to offer apology to someone's face. So, pretty amazing for the sort of end of the 90s to be taking that approach. And when I think about where we are now compared to then, it's pretty small fry really, isn't it? So, when Care Opinion came along, we had very sophisticated, compared to that, ways of gathering feedback from our consumers. And I think, like the experience of bringing everyone into the room together, there was no opportunity for everyone to learn from the compliment as well as the concern that was raised. I think that's the thing that Care Opinion has. It's the most innovative thing that has been brought to WA Health. That opportunity for the stories to be shared on the World Wide Web for everyone to read, the responses. We also have through, I think, practice and exposure and learning, a more sophisticated way of responding to concerns and compliments. You see that maturity over the years and the responses that come back from the various health services. And I think we have the opportunity to also recognise what I would consider happy circumstances or happy coincidence. So in someone sharing their story, a health service responding, and then also making the change that's required or celebrating the success from the compliment, we can have other spin-off effects. And I think about a story in particular that came through in the early days is a simple thing. Someone just wanted to have a bench seat between the car park and the respiratory clinic that they attended every 3 months because they just got short of breath coming from the car park. So the bench went in, hugely complimentary about that. And when you think about what other happy circumstance may have occurred from having a bench seat there, maybe there's an old frail person that also struggled to get from the car park. Maybe we've prevented them from having a fall because they've been able to stop and rest. And we can kind of capture the changes from the stories, but I think there's other aspects that there's a sophistication that the storytelling brings that we're yet to capture. But I think that's probably the best change and the best, I guess, happy circumstance of adding care opinion to our more quantitative closed circuit ways of capturing feedback.
Thank you, Karina. Tanya, I'll come to you on that. From a consumer perspective, Tanya, what role does support and advocacy play in helping people share their experience, particularly when they might not feel confident or safe doing so on their own?
Thank you. I think being able to support people to share their experience and their story of what has happened is really important, something that we take really serious, obviously, at Health Consumers Council. Stories are very important, experiences are very important. And I think the value of care opinion in that you're sharing the whole story. Some things are not necessarily complaints and they're not necessarily compliments. They're everything. Care opinion, because it's anonymous, can be, a real benefit to that. People may not want to put their name to it, might not necessarily it's not an investigation. They don't want it investigated. They want to be heard, as we've heard a lot today. I think being able to support people who may not otherwise give feedback or share their experiences with health services is really important. We include care opinion and how to use it in most of the training that we do with consumers, and for a lot of them it's the first time they've seen it, and people really love it. They like that they can go on there and share it. They like that they can see who's responded to it, where it's been sent and who's read it. I think that's a really important part, quite an empowering thing to know that the executive director of the health service read this and they're the ones that are responding. To know who's responding can be a really, quite a powerful thing. I think there are always going to be, getting feedback is such a gift. Most people don't give feedback. And we know, like you do a workshop, we were talking about it the other day at work, and you've got, 40% of people give feedback. And we're sitting there like literally in the room with time to give feedback and people still don't. It's quite uncommon. And so the feedback that people go out of their way to share a story on, care opinion or put in a complaint or I think is a real gift. It's rare and it needs to be sort of treated, I think, as that. And care opinion's one way. There are lots of ways of giving feedback and but care opinion's a very important way and we really love it, and consumers really do as well.
Thank you, Tanya, and I think you've said it beautifully in that it is a gift, and if we embrace it then and use it, it can be quite a powerful one. And the point of difference is the dialogue. It's two-way. When you complete a survey, we often have consumers say, what happens to it? Where does it go? Whereas with this, they're able to engage with it, see who's responded, what they've done with it. So it's really closing that loop in that dialogue. Emma, your work is in the community setting, and we receive many stories by phone from older patients and their loved ones about the rehabilitation in the home service. What led you to start using care opinion, and what were you hoping it would help you with?
I think for us, when we first started trying to look for consumer feedback in the community, we were looking to open up some accessible platforms for our consumers. Firstly, just to increase the amount of feedback that we and also so that we can get some richer feedback from our consumers. You know, using Care Opinion, they can give their own words, they can give a deeper understanding of the care that we've provided to them. We found it's much better with Care Opinion for our older demographic of patients that we have. They seem to prefer giving verbal feedback, or like was mentioned earlier, they like writing long letters or emails. And it's a bit nicer for our patients to give that personalization. There's normally set questions with other surveys that we use. So we find that they can really talk about their story and share what they've experienced. And yeah, it removes the barrier. It allows them to, we actually have a lot of patients or clients that ring up and they give verbal feedback to Care Opinion, which is then entered into the system for us, which is amazing. I think also I'd really like to touch on the fact that then we get to discuss this feedback at our team meetings, and also our stories are shared with those people that are non-clinical or corporate, so up to executive level. So they all get to see the care that's being given to patients on the front line by those staff. And it really starts to close that gap between understanding at that higher level that care that we are providing. And yeah, it makes sure that the consumer voices are heard, whether that's where we need some improvement in areas or where we've really outshone what the standard would have been. Yeah, and it allows us to do some deeper reflection and learning on the care that we're providing. And it really keeps the consumer experience at the heart of all of our improvements and at the care that we're giving to keep that high level that we provide.
Thank you for that, Emma. The next question is for Delaney. We see many stories from women and newborn health service where staff are recognised by name. What has public recognition through stories on Care Opinion done for your staff and the team's culture?
Thank you. I think I can address this at both the individual, the team, and the service level. So for individuals, we know that it means a lot to them individually because they tell us how much it means to them. We will do certificates. So we'll do a Care Opinion certificate for every staff member who is named personally, where it's signed by me as the Director of Safety and Quality and the senior lead of that service. And we put the story on the back so that they have that certificate with the patient's own words to keep in their portfolio, both from a reflection piece, but also because it feels good. And on those hard days, you have something physically tangible that reminds you of the good and why you do what you do. Within teams, there's lots of different celebrations. We have teams that will do morning teas where they celebrate someone who's had multiple positive stories, much like the mug. That's one way that the team has adopted that celebration. We have another team who, in a different part of the service, who have a Microsoft Teams channel for all their regular communications. And one of the channels is the Anya channel, where any feedback they get positive that names an individual gets posted in that channel, and then all of their peers will go on, and you'll see there'll be 10, 20, 30 of their peers that work in their immediate area giving it a thumbs up, a love heart, way to go, that's such great feedback, you're amazing. And so teams have taken it upon themselves to embed that celebration amongst themselves as part of the culture at a team level. Then from an organizational level, we've worked really hard to build that patient feedback into the day-to-day of what we do. So like most hospitals, we have sort of a daily stand-up, a daily huddle where we look at bed pressures, staffing pressures, activity. But once a week, Tuesdays is our patient experience day, where we bring up generally a Care Opinion story or a compliment and use that as a reflection. And we deliberately try to pick stories, that over time celebrate the breadth of the organization. We have some teams that get an abundance of positive feedback. We make sure it's not their story showed every single week, which we could do, but make sure that we share stories that in particular cover a patient's journey. You know, I came in for X and I came in through the emergency center, and then I went to theater, and then I went to the ward, and then I had follow up at home. And the stories where individuals are named, we try to pick those stories specifically because that promotes a culture where if Nurse Jane is walking down the hall the next day, someone can say, I heard that great feedback from you, that was amazing. And that we really make sure that we're reinforcing that positive experience in everything we do. So I think really making that patient experience part of the daily focus. And then what we see is it makes staff want to promote patient feedback. So one example, recently I was doing some rounding and ended up in an area where we get very little feedback from, but we were talking about patient experience and patient feedback, and the staff member actually flipped her lanyard over, and on the back of the little plastic ID card holder, their team had printed out QR codes. Independently, they'd done it completely of their own accord, that had a link to the feedback page on the website, which has the consumer liaison, links to Health Consumers Council, links to Care Opinion, all of the main feedback mechanisms. And this was our visiting midwifery service who go out and do home visits. And so they're able to, at the end of the visit in someone's home, go, if you have anything to share about any point of your journey, here, take a picture of this when you have time. If you'd like to give us feedback, please do. And they did this of their own accord. They just went, hey, we could slap this on our lanyard. And it's things like that that demonstrate, I think, that we're on the right path and that people are open to that feedback, because that is the mechanism for all feedback, not just positive, but they're willing to really promote that in people's homes as, we want to hear from you, please let us know.
Fabulous. That was a lot of gems were shared there. And I mean, you share it so beautifully, but I think it may have taken quite a bit to get to a culture where your teams are embracing this. They're welcoming this feedback. And yeah, so it says a lot about the leadership and a lot about the way your organisation is leading by listening to the voice of consumers. Do we have any questions from the audience to any or all of the panellists? We have a mic that Meg will bring around. Yep. Yes, please. Yeah, no, we do have a...
Just talking about translation of and closing the loop back with consumers. So with Care Opinion, the consumer puts up their story and then they get a response from the service, and then you may or may not make changes based on that feedback. Is there a way that we can use Care Opinion so that we can close that loop back with those consumers? Because some of this stuff or changes might happen months, even a year later. Is there a way that we, even though it's anonymous, how can we use the platform to close that loop more solidly?
We do. Would you like to share some examples on how some of the changes don't happen immediately, or what occurs is there are trends or patterns in some of the suggestions, and over time those changes are made and feedback is kept, is updated? Is there any examples you'd like to share? Thank you.
In health networks, when we got involved in purchasing Care Opinion for the state, we developed a dashboard on the Healthy WA website and also on the internal website. It displays how many stories for each health service and how many responses or watches of those stories. And there's also an indicator for how many changes have been made. I think that indicator probably is our weakest one for the reasons that you've already stated. You know, sometimes the change happens much later. Sometimes it's just hard to capture, or quite a significant change needs to occur, which can take months rather than weeks. But that's one mechanism that we use. I think the other one that I'm aware of is, you know, and I reflect on, you know, it's the little things that change culture, and, you know, QR codes on lanyards. You know, we often reflect on stories at various meetings. So we have a Care Opinion story when we commence our advisory group meetings we're developing a strategy in neurology for the state at the moment. So we try and share a story from that area. Similarly, there's some quality and safety committees I sit on, and there's always a story that's shared at the beginning of the committee that helps us to not only be reminded of who we're serving, but also it can stimulate that you know, ideas for change based on the person's concern or complement. It helps us identify exemplars as well.
Thank you. Any other examples from the audience of how this may occur within your services, where you've got a series or one story shared and there is a change, but it occurs later. How do you go back and close that loop?
So just on that, sorry, I work at Midland Hospital in the patient experience team, and sometimes people don't want to be contacted again. I think we need to respect that side of things, that quite often if we do put a response and say, please contact us, please reach out, we're looking at it, we either don't get a response, or if we do get a response, it's thank you for acknowledging it, I'm moving on with my life now. I don't want this brought up with me again. I've shared this. I'm not moving forward. However, a lot of people do want to know. And so I think it's a balance between reading the room in terms of do they want a response, and saying that if we are going to get back to you, we do that, and in the most timely manner possible. And I think when you don't get back to people when they've requested it, or keep them updated, I know it goes a bit off topic, but recently, like in SAC1 investigations and those sorts of things, people just want to know that they're still on your books, pretty much, and that we're still looking into it. You check in where you can. But I think there is an element of sometimes too much information is not required, and we need to respect that they've said what they need to say, and then we take it from there.
So communication 101 is just keep everyone in the loop. Yes, Claire?
I wonder, it occurs to me, I wonder whether or not, for example, being able to connect back in with the community advisory councils and or the district health advisory councils might be a way of at least closing the loop back to community. We all know that there's lots and lots and lots of reports that are done in health, and a predecessor of mine, Pip Brennan, who many of you will know, at one point we talked about, wonder if we should have like recommendation watch, which is like, let's just keep a list of all the recommendations that have been made and go through them every so often and say, how's that one going? How's that one going? But you could do that with care opinion. Where a change is planned, it could become the opportunity for the CAC or the DHAC to become a little bit of the watchers to some extent, which is just to, be a mechanism by which it's at least getting fed back to community.
Thanks for sharing that, Claire. And we might have one more question if there is anything from the audience. Yes, Neil.
So it's just more of an example. I really want to build on Emma's point. Thanks, Emma. So thanks in a large part to Leslie's leadership at East Metro. Our area executive group always starts after the acknowledgement with a care opinion story, and it rotates around all of the executives. So they have to take ownership for the story, present the story. And these aren't the sugar-coated ones. So they give us an opportunity to review and learn across the entire executive, so we all own the issues. So it's really great practice.
Yeah, fabulous. Another great example. Thank you very much for sharing that. We have run out of time for this session, so please join me in thanking our panelists for sharing those insights and experiences and for bringing to life what consumer voice looks like in practice across the various settings. We're most appreciative for your time and your contribution. Thank you.